Tim, thank you for joining me today.
Great. Fun. I'm looking forward to it.
Well, you know how it goes. We always start with a quick fire round of questions. Are you ready to go?
I'm all in, as always.
All right. Did Zoe members save lives during COVID?
I think they did.
Are there ways to reduce the symptoms of long COVID?
Some of them. Yes, not all of them.
Did you take the COVID vaccine yourself?
I did. At least 3 times.
Can certain foods reduce your risk of getting COVID?
Yes.
Do you think that you'll see another global pandemic in your lifetime?
50-50.
Thank you, Tim. And then finally, what's the biggest misconception about the COVID pandemic, do you think?
Oh, there's so many. But I think the global one was it only affected old people. Young people didn't have to worry about it. And that's really before we all knew about long COVID.
So what lots of listeners will know, but also lots of listeners to this podcast won't know, is that Zoe was actually very involved in COVID during the pandemic. And so I think that's another reason that I'd love to look back. So, for example, the reason that we started doing anything on YouTube is that we actually uploaded a video to explain to people how to use our brand new free COVID app. And this was sort of the introduction, right, Tim, for you doing what became regular weekly videos and then made us think, well, we should really go and do a podcast.
Yeah, absolutely. We had no idea then what we'd be doing now, or that anything we were doing during COVID would have any relevance afterwards. And I think it's only with hindsight, looking back, that we see, all the amazing things, in this time of disaster, how some things really worked and not only changed how Zoe works, but also how we changed a lot of the face of research as well, and also interacting with the public. So, lots of things, I think, came out of the interaction between this terrible virus, public reaction and companies like Zoe, and working with academia and King's. There's so many lessons I think we learned from it that were very hard to learn at the time because it was at a frenetic pace.
And Tim, can you take us back, to that time almost 5 years ago? Like, what were we doing at that point before COVID hit? And tell us about that lead up to this conversation, which I remember very well, where you gave me a call and said, hey, we need to go and do this thing.
So March 2020, Zoe had actually been in existence for nearly 3 years, which many people don't realize. They think we only started during COVID. So we were doing this study to see if by giving 1,000 people identical meals, whether there was enough difference in their response to these to make a difference, and then we could then predict how people responded differently. This is all in order to get a way of measuring personalization so that we could give people personalized advice, given the fact that people respond very differently to foods. So this was totally new territory. It was a theoretical idea that we had. There was some very little bit of data out there, but no one had done this for blood sugar, for blood fats, and gut microbes all together. And it was by far the biggest study ever done. Huge risk, but it paid off. And we were able to estimate from these results with our clever computer scientists algorithms that could be used in an app that would then allow people to give personalized scores for their food. So that was where we were. And we were just starting to get the app together. And then suddenly everything came crashing down. And we're told in the US and the UK, on virtually the same day, everything had to stop everywhere. So it was like science was suddenly on hold, and science is my life. So it was a terrible feeling, and suddenly felt very depressed and rather lonely as I cycled home, and everyone around you, was either very frightened or sad, anxious, depressed, all kinds of emotions going on. But by the time I'd cycled home half an hour, I'd said, well, there must be something we can do. And my initial idea was to use our twins, that we have this huge twin collection in the UK, 15,000 twins all over the country, that could be used as like canaries, if you like, beacons for this pandemic, so that we actually work out what's going on. And the idea was to use an app that the team at Zoe had been developing for nutrition and swap it out for COVID. And so this suddenly transformed me from being super depressed to being energized. And I remember ringing you when I got home. I said, I got this crazy idea. And far from you dismissing it, which I was expecting, you said, well, that's great, but we don't have to do just twins. If it's an app, anyone can download it. We can use it, far wider. So you had an even bigger vision of it.
As someone running a company that does a lot of data science, here's something that fascinates me. YouTube tells me that 69.3% of you who watch this channel frequently haven't yet hit the subscribe button. So I want to ask you a quick favor. Your choosing to subscribe helps us a lot. It helps us make the show better, access world-leading experts, and ultimately make more progress on our mission to improve the health of millions. So if you enjoy this show, all I ask is that you hit the subscribe button. And in return, I promise we'll continue to make the show better and better each week. I remember this incredibly well because I was in my study, which I spent much of the following 2 years in, right? People who, I'm not a doctor, right? So you were going into hospital and I wasn't. And I remember this call because I think I also felt this is awful what's going on and I really want to be able to do something, and I feel really helpless and useless, which I know, talking to lots of people, was one of the very common feelings for people who weren't medically trained. And you came up with this idea about how we could use a lot of the technology we've been developing over the last 3 years, and it felt like we should. It felt like this was really important and we should stop the business that we were doing and just focus on this pandemic.
Yeah, and it was great. So getting that positive feedback, and our other co-founder, George, was in agreement. And then you got the approval of the investors, didn't you? Who, it was their money after all.
Correct. And I think they deserve a shout out, actually, because, often, people think about these investors as only caring about making money. And actually, we basically said to them, we want to stop doing everything that we're doing on this nutrition science research. I know we said we're about to go and turn it into a first product. We want to stop all of that and get everybody in the company, all the engineers, everybody else to work full time on a completely free app for the pandemic, which has no commercial purpose. We just think it's really important and we need to work on it. And amazingly, they just instantly said, yes, that sounds like the right thing to do. You should just do it. We've got your back. Yeah. And I would actually like to say I'm immensely grateful, because I think that they didn't have to say that. And it made me feel really good over the next year, when I think we then went on to work ridiculously hard, didn't we?
Yeah, it seemed like we were doing about 5 jobs at once, rather than, a lot of people just went home to do the gardening. But
do you want to talk through what happened over the next 5 days?
Yeah, well, I think about 30 people in Zoe at the time. Everyone was super energized by this idea, and it, like everyone during that time, it was so good to have a purpose. And the team basically worked night and day, at least 20-hour days for 5 days to get this app up and running, because we realized it was totally time critical. There'd be all kinds of other things going on and distractions and surveys, and the government was saying they were going to do stuff. Basically, if it wanted to have an impact, it had to be early. And so I couldn't believe that it was ready. And there it was. It had bugs, it had clunks, it had all kinds of things, but we got it out there. And then with our social media contacts, got lots of celebrities to retweet the link to the app. We had 1 million downloads in the first 24 hours, which completely crashed all our rather puny systems and amazed us. But I remember the night we launched, there was a little ticker we had on it, just showing the number of people on it. And it was super exciting. And the feedback was immensely positive, that people just wanted to be doing something. Because they, just to remind people that maybe who didn't see this maybe in other countries, that we were asking people to report their state of health. How are you today? Do you have any of these following symptoms? Have you had a COVID test? And then giving them feedback about their area, about how many people in their area were reporting the similar. So it was very much like the sort of canary in the coal mine idea, but with 1 million people reporting. And it turned out to exceed our wildest dreams about how popular it was.
Yeah, and I would add that it was built on the technology that we've been working on for the last 3 years. So we've been doing what in science were like huge remote clinical trials, right? 1,000 people is enormous for like human trials historically. And so we built these apps to be able to collect very large amounts of data remotely. In fact, nothing was down for more than a few minutes. And we were able, in fact, to support, 1 million people at the end of the first 24 hours. And we were like 4.5 million people after about a month. A lot in the UK, but also in Sweden and in the United States. And that basically we sort of had this back-end infrastructure. We also understood how to do stuff that was going to be compliant for clinical trials, for clinical research. So we were in the right place, right? We'd built this understanding, but then we needed to know how to use it. And I think we had this amazing support from you and a lot of scientists and doctors at King's College London, right, to understand what were the right questions and problems. There will be a lot of listeners who participated in what ended up being called the Zoe COVID study. What did we get out of this? And in retrospect, as we look back, was there participation? Many people sort of shared their symptoms every day for, a couple of years. Was this worthwhile and valuable?
It turned out to be immensely valuable in many different ways that we hadn't predicted. So first of all, the thing that people still come up to me in the street and say, thank you for everything you did in COVID, was a psychological effect that none of us even thought about, that just by getting people to participate as a giant community, they were helping their own state of mind. This idea of participating and being part of something bigger than just at home isolating had a real bonus on their mental health. That psychological impact was probably the most important to the people doing it. Then there was the idea of the things that we were doing for the country and the world. And I think the first thing we were noted for was picking up these new symptoms. Initially, we were told the only two symptoms definite about COVID were a persistent cough and shortness of breath. We were asking about other symptoms, and we very quickly picked up this loss of smell that about 1 in 5 people were getting.
And Tim, for people listening to this who, will never have used this app during the time, why were we able to pick up symptoms in a way that, there were hundreds of thousands of scientists around the world suddenly thinking about COVID that they weren't able to?
Because we were getting daily updates from 1 million or so people on their current state of health in real time. And no one else was doing this. Others were depending on slow surveys, still using, even questionnaires. Nothing like this had ever been attempted before. I think there'd been some sort of community studies about people looking at stars and reporting what they were, but nothing in the health sector at all. So this is by far the biggest sort of mass community study in real time. And it was the idea that every day we were collecting data that was telling us what was happening in every region of these countries, that not only gave you an idea of the state of the pandemic, so we were able to pick hotspots, which areas were going up, which were going down, but how the disease was changing and how the symptoms were changing and how they were linked to people of different ages and vulnerabilities, etc. So that was really quite key, and no one else had that data. And that's why the loss of smell for everybody, and we found different symptoms in children and different symptoms in the over 80s with delirium and other things that weren't at all noted. We were the first to point those out. It changed the WHO criteria of the symptom lists, and most countries changed their criteria based on those Zoe results.
Which means based really on all these 4 million people participating in this app, just sharing their sort of symptoms each day and whether or not they got sick.
Exactly. And instantly people saw the scale of what we were doing and the fact we were reporting it very transparently in real time. There was no fiddling of results. It was just, these are the data. And that's why these major health organizations very rapidly changed their criteria and then changed their public health departments to say this is what to look out for. It's not just a cough and shortness of breath. There are these other features. It's rather sad that the English government, English NHS, were the last to actually approve these, rather ironically. But there's...
We were very more than frustrated. I remember we were really angry at the time because we felt people were dying as a result of...
Yeah, because they're still going to work or going to parties or meet old people with having completely lost their sense of smell, with a government saying, oh, well, we don't believe these results. We're waiting for our own ones to confirm it.
And I remember when we were doing this, now this all seems a bit obvious, but it was very radical, right? And, my background was sort of big data and internet and stuff like this, but I'd never done anything in health. And you're one of the top scientists in the world, Tim. I don't need to tell you that. And you'd been used to doing what seemed like very large data within science, but very large data for you was you might have
a few thousand.
12,000 twins and get 1,000 people in a study. So this was something really radically new. And I remember there was a lot of debate about when we were starting Zoe, was it possible to do real science where you just did it remotely, so people weren't coming into a lab or a hospital, and where if you could get to millions of people, you could discover all sorts of science that's just not possible with 1,000 people coming into a clinic, even though, of course, you always have better medical devices in the hospital, but the trade-off is you get so many more people. And
there was a lot of skepticism at the time, and a lot of critics, in academia didn't like what we were doing. They said many things. People will lie to you if you're not seeing them face to face. So they're not going to tell you the truth, which turned out not to be true. The other thing was they said no one over 60 is going to use an app. That's what the medical profession generally think of the intelligence of over 60-year-olds. that they're incapable of using apparatus. And we showed that blew that out of the water completely. But that was at the time... It seems mad now, but actually that was the sort of status quo of the reasoning. You don't do studies in older people with technology.
And I think they also said you'll never be able to do proper quality science. So did we manage to get proper quality science that was peer-reviewed out of this?
Well, we ended up being probably the leading research group in COVID in the number of high-quality papers we got with a number of people. So I think it was over 40 peer-reviewed papers in the very top journals, from New England Journal, Lancet, Nature, and these are still very highly cited papers today. One of the most important ones I was looking up the other day, I think the most highly cited is an early one that showed the infection rates of COVID in people who were working in hospitals compared to the community. And we showed a 10-fold increased risk in the US and the UK, and people were one of the very first ones to show the risks of working in hospitals. And it was also correlated with how well staffed they were with equipment. You could look at the geography of saying this state or this place had very little PPE and didn't give its staff proper masks, and therefore the rates were even higher. So we were great on symptoms, and as the variants changed, so the symptoms changed. And we had this big debate about it switching to be more like a really starting like a cold, and we spotted that several weeks before any of the other systems because ours was always much faster. The other thing I think these hotspots we were finding in the early stages before there was any testing. We also found a lot about vaccines. So we had over 1 million people reporting what happened when they took those first vaccines, because there was a lot of anxiety about vaccines at the time, a lot of misinformation. And so we obviously were able to give independent information about not only what were the side effects of those first vaccines, but how effective they were. And we were the first to confirm in very large numbers what the smaller clinical trials had shown, that these vaccines were protecting people between 70 and 85% compared to not having it, and they were reducing severe COVID in big ways. So I think they were the sort of things that I remember as the major things, but there were so many other aspects that we also were fascinating about the spread and the infection rates, and then we were the first really to write about long COVID as well. And I wish we'd been able to do more on long COVID, but we weren't able to access the people with severe long COVID because they'd been gone to hospital, and people in intensive care are obviously not filling in their app. So we always were focusing on the milder cases, and I think that wasn't appreciated by everyone at the time. So we could talk about long COVID in the community, but we couldn't talk about those really severe cases. So I think they were the major achievements, as well as we did do stuff about diet and supplements.
I'd like to take the opportunity just to thank everybody who participated. You know, there were millions of people in the UK, in Sweden, in the US who did this, you know, selflessly and contributed. And I think you just hear like the amount of impact. I think that's amazing. I'd also like to thank everybody at Zoe who worked incredibly hard to make this happen. And it was really, really intense. I remember juggling this and looking after my then not yet 1-year-old with no childcare for like the first 4 months. My wife's a doctor, so she was very busy. So it was a mad time. On the other hand, you know, it certainly gave me purpose, and I think got me through that actually in a way that was much better than many people, as I discovered subsequently, because I felt like I was very busy and I had a lot of purpose. And so I think actually it was very good for my mental health to feel that in a time that's difficult. But I'd love to look back now at the pandemic and understand, you know, what did we get right across the world? And there were obviously very different reactions in different countries, and we got wrong. And actually, I'd love to start with something which at the time I remember was viewed as complete conspiracy theory, which is where did the virus start and how did it spread? But I understand, Tim, that there's been like more real examination. So could we start with that?
Yes. So I don't think there's any doubt that this virus emanated in China, in a place near Wuhan. And the question is, did this come from bats? Did it come from a lab that was working on this virus and manipulating it to make it grow faster? Or was it a totally artificially generated virus to cause harm that they then didn't control? And the initial ideas and the government official response was that this was related to bats and was a natural phenomenon that came out of this market in Wuhan. And it's looking increasingly like that was a bit of a cover-up, and that the most likely source of this was a lab leak from Wuhan. And there have been a lot of US congressional hearings talking about how there'd been work between US labs and Wuhan labs to basically look at the infectiousness of these viruses and how you might control them or speed them up.
You said it very calmly, but it sounds quite radical. You're saying genuinely, when you look at the sort of the data trail and the science now, that you think there is like quite good evidence to suggest that it might actually have come out of a lab rather than just somehow transferred from an animal to a human being in China completely accidentally?
That seems to be the most likely scientific answer for what went on, that explains both the epidemiology, the timing, also, the trail of shredded documents and email exchange between the US and China at the time. And it's also, there was a very obvious cover-up very early on by various governments saying we have to get a report out there saying this is all down to bats. So people aren't going to blame labs and scientists to keep that credibility going. So that's my personal view. And there are views on all sides of this. I don't think the idea that someone built a virus from scratch would be very easy to do. So I think it's more likely that it was a mistake rather than anything deliberate. But I think these were people working with hazardous viruses that got out of control rather than it being a plot.
It's slightly terrifying. I mean, you say that very calmly, but it's slightly terrifying because it does suggest, in a way, it makes it feel more risky that something like this might happen again.
I think particularly if this cover-up sort of continues and people don't admit that it actually happened, at least in the US, is quite open. It's interesting, in the UK, there's very little coverage of this going on, and I think it would be better to be more transparent and say, are there labs around that should be controlled like you would control nuclear threats or anything else that's extremely deadly? So I do think we need more oversight on this, because if that is the most likely solution, well, that could happen again in another lab if we're not careful. So let's just keep our eyes open about this. And I think, like many things that happened in COVID, there were some things that governments did as if they were in a war situation and they had to take control of everything and make these decisions. And some of them were good and some of them were bad. And I think we've just got to be honest about that. And I think some of these decisions just need to be now looked at again, and perhaps with greater transparency going forward, so we can make sure it doesn't happen again.
Well, you slightly shocked me with this one, Tim. So I think I'm going to go on to the next list, which is really about protective measures. And I guess the things that, when we think about COVID, that we'd never heard of before, but then we got really used to, was mask wearing on one side, which, for some people in Asia, they'd obviously been used to, but for the rest of the world, we'd never been used to wearing masks. And the other one is sort of shutting down interactions within society, whether they are, they were called lockdowns in various countries, or school closures that we saw across the world. What have we learnt about the effectiveness of those protective measures?
Well, mask wearing was very controversial, and basically most countries divided into two groups of people, the sort of pro or against, a bit like religion. And the early studies didn't show much benefit for masks, and partly that was because people weren't wearing them properly, had them around their chin most of the time, or they were very flimsy cloth ones. But the latest summary of all the studies shows that proper mask wearing does reduce risk of infection significantly, and the better the mask, the better the protection. So I think now we know that masks do have some benefit if worn correctly, and a lot of the studies included people who weren't wearing them properly at the time, and we didn't really know exactly what was going on. So that's a good lesson for the future, that if you want to stop a virus that's airborne, make it really hard for that virus to get into your mouth and nose, which is where they get into the body. It makes sort of sense. The other measures we had on lockdowns, the data is not so clear. I think some countries were able to survive without lockdowns because they had very good medical facilities and the hospitals weren't overrun. And so in that first wave, they didn't have to stop the whole of society and cause massive economic problems. They had enough hospital beds and doctors and nurses to treat that first wave. For countries like the UK and many states in the US, they weren't able to deal with the huge wave of respiratory problems. And so without having people who were dying in the streets, some lockdown was necessary. Now, whether subsequent lockdowns were effective or not is somewhat debated. I think it's very hard to generalize across every country about whether they are effective or not. We were advising number 10 at one point, a group of epidemiologists, about whether there should be another lockdown or not, looking at all the data. What prevented the virus was the amount of movement of people. And there are these scales for measuring movement. And we were down about 70 or 80% for most of the time during these crises. So if you see people coughing and going to hospital all around you, it's going to change your behavior, whether the government tells you to do things or not. And you would often get these peaks preceding before the lockdown happened. And so actually people were deciding themselves to self-isolate and do the sensible thing. So it's not clear that governments need to take this action. It could be that the more vulnerable people made their own decisions to isolate, and they didn't need government to do that for them.
And what about school closures?
School closures were pretty much a disaster. I think that was one thing got very wrong. I don't think we really thought through the consequences of stopping children going to school, meeting other kids, interacting, with huge mental health sequelae after it. And we got it wrong. We thought that, children were at risk of the virus themselves. And turns out, it was just very much like a common cold for the vast majority of them, or they had nothing at all. And I think in retrospect, we should have produced much more different rules for children, because we had this obsession with if we locked down until they were vaccinated, then they wouldn't carry on infecting other people. It turned out even after vaccination, they were still able to infect people. And so that was a really false fallacy. And so they're the ones, I think, who suffered the most during this. And we're seeing this epidemic of mental health issues around the world from this group, and who also suffered educationally, retrograde back a year or so in their education. So that's one thing we got wrong, and the epidemiology expected that children would act the same way as adults. And I think this is something we need to learn for the future, that there is this payback, and that the people who aren't suffering the consequence of it shouldn't sort of pay the most of the penalty.
Getting older, I've realised that what I eat makes a massive difference to my health. Now I'm eating the things that help my body feel great. With Zoe, I've got actual science to guide me, and my test results help tailor my advice. I'm making smarter choices every day, like what to add to my plate. It's like having a nutritionist in my pocket. It's changed everything. I'm living my best life. I'm going to be clubbing with the grandkids. Join me and over 100,000 people transforming their health with Zoe.
Reminds me a little bit, interestingly, of like the day-to-day experience that I have at Zoe around extending your healthy years versus, disease and being sick. It feels to me that it's very in line with healthcare in general, which is very, very focused on avoiding somebody dying. And therefore, we put this enormous amount of our resources right into the last 6 months of someone's life and spend almost nothing trying to actually improve people's health before they're really sick and giving them many healthy years. And, Zoe is all about understanding how you can feel better now and you can live more healthy years. And you have people saying, well, aren't you just like, looking after people who aren't sick yet? And I'm like, yes, because getting many more healthy years is great. And somehow it feels similar. It's like very focused on people who might die from COVID, which is awful and of course should be avoided. And as I said, I think very much about my parents, but not really measuring very much the sense about the harm that it was doing to, our children and other people who are locked down and all those mental health problems, because it's that very measurable death seems to get such a high weighting that I see that in nutrition. But do you think that played into this as well, do you think?
Hugely, yes. And you can sort of imagine it from a politician's point of view. Are you going to say, okay, we'll allow schools to carry on, and there's a risk that some of those kids will go and infect their grandparents, and those 85-year-old grandparents are going to die maybe a year or two before they would normally die, in order those kids can go to school. So that's not something that's easy for any politician or anyone
when
public
you describe
to
it like
say
that, it's an incredibly difficult choice, isn't it? Because, I think one of the things we all felt was our relatives are really important to us, right? And I think one of the things we discovered is we're willing to put up with a lot in order to protect them. It just feels like we created a lot of harm here with children that I think we weren't really aware of. And I think you're saying if we were to redo this, we could have let them go to school and not really affected the death rate very much.
Yeah, absolutely. And I think this is a debate every country needs to have about what is the price of each year of life. Is an 85-year-old living to 86 more important than some child losing a year or two of education and having mental health problems for the rest of their life? Or these aren't easy things to talk about, but I think in healthcare, the US is even more extreme. It spends about a third of all the US healthcare goes in the last 3 months of life. And I think we have to start reevaluating this really moving forward, and as we start putting money into preventive health. The other element that comes in, we haven't really discussed, is economic. And these lockdowns had huge economic costs. And epidemiologists know there's a clear link between the economy and health and long-term health outcomes. So I think in future we also need to be modelling, saying, well, for every dollar we're losing, that's going to cause more suffering more health issues as well. So it's a much tougher holistic experiment than I think we've realized. And I think next time round, we want to be more prepared into this to say, well, this is the things that make sense. We know these factors are important. Let's have a much more grown-up debate about it rather than just reacting to things.
And it sounds like you're saying that in particular the schools is a thing that you really feel we should have done differently across the globe.
Yes, and it's also how we treated the children, and we know that, in certain states in the US, they really sort of picked on kids and said, well, even 5-year-olds have got to be vaccinated, otherwise they can't go to nursery school, or and there was no science backing this up. And I think we just have to realize where we made mistakes and where we did really well. And the vaccine story was an incredible success story overall.
I was going to say, can we talk about that
Yeah.
now? Because, when we were asking for questions on this episode, we had a lot of questions about the potential side effects from vaccines. And we also had questions about whether the risks of vaccines actually outweighed the benefits. Have any studies been looking into this? And what is the verdict now looking back?
Huge amount of studies looking into this. So for adults, the vaccine prevented 70 to 85%, depending on the vaccine and the timing, of COVID infections. It was even slightly greater for severe COVID, and it also reduced long COVID. So you're like 4 or 5 times less likely to die if you had been vaccinated than if you hadn't. So there were huge differences.
And so just to make that really clear, your view today, if advising an adult about whether or not they should take the vaccine, is?
Well, I mean, I took the vaccine and I was very glad I took it. Obviously, you're reducing your risk of getting that infection. And if that infection is likely to have a risk of death, then you're going to reduce that equally. As each phase of the COVID gets weaker, more infectious. So what's happened is exactly as predicted. Each variant of the virus has become clever at evading our immune systems and has kept mutating. And so it's even more infectious than it was right at the beginning, but it's much less likely to harm us severely or kill us. And so this is what happened to the original Spanish 1917 influenza pandemic. And it took about 7 or 8 years for it to blend into the background. So when we're talking about vaccines now, it is different to what it was in 2020 when the mortality rate was huge. Still, we think about 20 million people worldwide have died of COVID. So I'm not trivializing this anyway.
Which is an enormous number of people, right, from something that didn't exist 6 years ago.
Correct, and just seemed to come out of nowhere. But it would have been many more if we hadn't had the vaccine.
And so what do you say? There's lots of people who talk about side effects and focus on those side effects. As a doctor and a scientist looking at the data now, how would you help someone who's worrying about that and trying to understand, did they do the right thing? And indeed, if they are thinking about vaccines
these
today?
COVID vaccines do have side effects. And because this is probably the most studied vaccine in history, even in our Zoe survey, we had over 1 million people we were looking at. We could see these rare side effects quite well, and you can get problems of the heart, myocarditis, pericarditis, occasional brain problems, but you get like 10 or 20 times more if you get the infection. So yes, there are side effects of the vaccine, which is giving you the virus in a mild form, but if you have the virus in the full form, the wild form, you're going to get many times more. So that's why for adults, the risk-benefit ratio is for the vast majority of people always positive. For children, it wasn't the case. So they didn't get the same advantages because they were relatively protected against the virus.
What you're saying is if they got the virus, they weren't likely to be sick.
Weren't much less likely to be sick or have major heart problems or die. And therefore, in many cases, the risk of the side effects was great as the risks of the actual virus itself. So I think most countries moved away from vaccinating children fairly early, but some stuck with it, particularly some US states. So I think that's where a lot of this controversy lies. But there's a big difference between talking about children and talking about like the average sort of 50 to 70-year-old person. And of course, everyone's got their own personal story. These vaccines wane after time. So it depends when you're taking it. And when people are listening to this podcast, there might be a vaccine that's just come out that's really good against the latest variant, and it's just coming up to winter and you want to be protected. That's when it happens. You're offered another one that's, just about to go out of date. It's really good against the old variant and that's changed. And actually, you're coming up to summer and there's not much going on, and therefore you're better off waiting. So it's become slightly more subtle in terms of what we do. But I don't think because of these subtleties and these rare side effects, we should in any way think that vaccines in general are, problematic. Because of COVID, there's been this terrible anti-vax movement that's sort of thrown out everything and sort of suddenly saying, well, we can't believe anything these guys are telling us. And therefore, kids are now dying of measles, really important cervical cancer vaccines are not being taken up. And we're not using this incredible technology that was the whole world got together to get together to fight cancer and things like this. So let's be sensible about these things. And in general, follow the advice, because the value of vaccines is huge.
Got it. And here what you're saying is overall the vaccines were great, but in children, when we look at the risk reward, particularly I think you're saying for younger children, actually the risks from COVID were really overstated. They were very low. And therefore, when you look at these rare side effects, it's like, well, those risks are as high or higher than COVID. So it doesn't make sense there. But I'm nearly 50, or I think about my parents in their 70s. You're saying it was a very different calculation?
Yes. And as you get older or you have a medical condition, then, that ratio changes.
And what about today, Tim? Because I'm really struck how much COVID is still going around, right? I sort of had this thing, everyone's got a vaccine, it'll disappear, you'll never hear about it ever again. And I'm struck by how many people say, I can't come to this event, I'm really sick and my whole family's sick and we've got COVID. And some people getting really sick with it, I noticed. Like some people, feeling really unwell for long periods of time. What does that mean about people thinking about vaccination today, as opposed to, presumably already having had previous vaccines during the pandemic?
Yeah, I think the big worry now is not so much death. It's more about long COVID. And the current estimates are that around 10% of the people who have been infected are going to have some degree of long COVID, which means it's going to last at least 3 months. And that means many people are left with all kinds of weird configuration of symptoms that is going to impair their life. And we do know that vaccines reduce the risk of long COVID, estimates something about 50 and 80%. So that's probably the main reason to be taking it. And strangely, we would have thought that if you had COVID multiple times, you're not at risk of long COVID. But actually, the more times you've had it, it slightly increases. So it doesn't disappear. People would assume that, I've had it once and I didn't get long COVID, I'll be fine.
You've incredibly depressed me, because I had assumed until 30 seconds ago I've had COVID after my vaccine and I didn't get long COVID, so I'm totally fine. And now you're pulling the rug out from underneath me, Tim.
I believe that as well. I thought, I'll be fine. But I think there is still this risk of long COVID, which is probably the major one that's still hanging over us. And has a major psychological, financial, economic, everything component. Everyone who's been through long COVID or is still suffering knows how important it is. So I think that's the main consideration, that we shouldn't just, completely ignore these new variants and these threats. We're not out of the woods yet.
And are a lot of people getting long COVID?
There are, yes. So those numbers haven't really dropped. And it's not in the news and they don't get the attention they deserve. And as yet, we haven't really found a cure for long COVID. So there have been lots of trials done and we're getting better at spotting the symptoms, but there's no There's no magic test. It's not been easy for the medical profession to try and work out what's going on. Some signs we can deal with some of these symptoms, but the ones with tiredness, etc., we've made lots of mistakes. We used to tell people with long COVID to exercise more, just get out there and pull yourself together and go for a long walk. 90% of people got worse when you did that. So actually, that was the wrong advice. The advice is really to rest. So we're still got a long way to go in dealing with long COVID and the results of that. There are millions of people around the world who are still suffering, and I think we shouldn't forget them, because as people like ourselves are trying to move on, there are many people who can't, and I think that's very important. And there are a few promising drugs around, but they seem to be treating individual symptoms rather than the whole thing.
Well, I think that it makes you realize just how terrible a virus this is and has been, doesn't it? Because not only, there will be lots of people listening to this who lost loved ones during COVID. I know many people who lost parents and other relatives, many people obviously who suffered really significant mental health issues, but then people still living with long COVID, but still getting it now, and makes you realize just, the world is a worse place as a result of this COVID being out there than it was, is really depressing. And I guess it's a good transition to the final things I'd like to touch on, really, which you mentioned, in the quickfire at the beginning about the risk of another pandemic, that this might not be the only time this happened. You said it was 50-50 in your own lifetime whether we had this again. And I know the team shared some research showing that these pandemics are getting more frequent and severe if you look across history. I think I'd like to focus on what people can do to prepare, rather than, I think maybe there's a whole nother podcast about what governments might be able to do, but what can people do? And given that this is Zoe Science and Nutrition, I'd maybe like to come back to that quickfire answer question right at the beginning, where you said, well, actually, there's things you can do with your diet that can really reduce your chance of getting COVID and reduce the severity. Because I think some people listening to that would be like, well, that sounds totally crazy, like total quackery. And I think the first time I heard you talk about this, I was like, surely not.
Obviously, the last thing most doctors talk about is diet. That's why, we tested about 100 different drugs in COVID, and people are still obsessed with the anti-worm drug ivermectin as being useful, although 14 randomized trials have proven it doesn't work. But we did a study of 1 million people, followed them up and worked out how severely they got COVID, and there was a clear relationship. That was the strongest factor after age was the quality of their diet. And if they had a high ultra-processed food diet, high inflammatory causing diet, lack of fiber, all these things had a surprisingly high impact on their risk of having severe COVID. I think it didn't so much stop you getting it, but it stopped it being really bad. So the first thing anyone listening to this can do about preventing any sort of nasty illness that's going to impact your immune system is to build up your immune system. How do you do that? Improving your gut microbiome. And how do you do that? Through your diet. People are going through the Zoe nutritional program will know exactly what I'm talking about, but it's basically this idea of more plants, diversity, high fiber, feeding your gut microbes in a way that is going to help your immune system. So that's number one. The other is try and keep your weight under control. So obesity turned out to be quite a major factor. There's some evidence that people taking metformin, interestingly, which is a drug that's been around for 30 years treating type 2 diabetes and is being researched out as an anti-aging drug, can actually reduce risk of infection. But we don't know whether that would work for avian flu or anything else. But there's an interaction between some of the drugs people commonly take and our immune system that we still don't understand much about.
If someone's listening to this, they might well have the same response that I had originally, which is like, I understand how eating food can affect my weight. I can sort of understand how it affects my mood now, because you sort of talk about the bacteria making things. I can sort of get there, but sort of the preventing me, getting really sick with a virus, it sounds like a sort of crazy stretch. How does this work?
Okay, to understand how you might fight off an infection or keep it minimal under control through your diet, you've got to understand the link between the food you eat and your gut microbes and your gut microbes and your immune system. We now know that most of our immune system is in our gut, 70 to 80% of it. And the way it gets its signals and it understands what's going on around it is through the gut microbes, most of which are in our lower intestine. There are 100 trillion of them, same number of cells in our body. And we all have very personal, different ones. And you can change them rapidly within a few days by altering your diet. And the healthier your gut microbes, the more diverse they are, the more good ones, the less bad ones, the better you're going to be able to control your immune system. And if you control your immune system, this means it's going to react appropriately to, say, a virus. It's able to fine-tune your defenses, and it's not going to waste lots of energy. So people eating a junk food diet, have very little fiber, and a typical American diet is going to have an inflamed gut microbiome that's going everywhere. It's all distracted. It's trying to put out fires all over the place. And so when a real virus comes along, it's not able to really pin it down. So that's why keeping our immune system in perfect health is really crucial. Not only is that good for infections, but that's also good for aging and also fighting cancer. It's the same principle. That's why microbiome and diet keep coming up in all these diseases. So if you want to have the best immune system, you need to make sure your gut health is in the best possible way. And as Zoe members know, it's plant diversity, it's fermented foods, which we now know are really good for the immune system. And this means foods with probiotics in them, live microbes. And it also means not having ultra-processed foods and getting plenty of fiber in there. So I can't stress enough, that's the reason that we saw these big differences in social class effects on severity as well. It's all linked to diet as much as anything else.
And so does that mean that when I'm feeling sick, the way I historically would have responded to that was, I'm just going to eat loads of junk because I'm not feeling very well. So I think just indulge myself. I historically thought that seemed perfectly reasonable. After all, you're not sick most of the time. So it's a time, to throw anything you might think about healthiness away. Is that fine? Or actually, when you're sick, should you almost be doubling down on making sure that you're eating, these foods that are supporting your good microbes?
No one's done the study suggesting that people like you go and, divide into two groups. But all the evidence suggests that we should be really focusing on an immune-boosting nutrition when we're sick and not going for the comfort food.
I definitely think a lot more now about okay, am I still eating sort of good food that is supporting my microbiome in that situation than I would have done? It's like one of the things I think I've really changed. So I understand you saying there's not the proof, but it's definitely changed my mind because I've sort of got this idea. I want to keep the microbes helping me out. I don't want to, because I can tell I'm in a sort of internal battle.
We're getting this evidence from our studies, like in sleep. If you have a poor night's sleep, you feel terrible, and your brain sort of picks the wrong foods for you to make you carry on feeling even more terrible. So I think we've got to start realizing there is this really close link between our brain, how we're feeling, our immune systems, and the diet. But let's not lose track of what our gut microbes need in order to keep the immune system going is even more crucial. So, there was some tentative evidence that things like probiotics could help, artificial versions of fermented foods. And so, if next time I get COVID, and I have done the last few times, I am really hitting the fermented foods and making sure I'm getting plenty of fiber.
Tim, I have many more questions, but we definitely hit time. Thank you. I'm going to try and do a quick summary across this, as always. So I think we started by saying that there's been an opportunity to reassess everything because we have distance and data. And this is one of them, you said it's the most studied virus ever. there are a set of things that I think we've come through and we feel really good about. So you said, we feel really good about the vaccines. They've turned out to be safe. They saved many, many lives. There's things like masks where you're saying now that we've been able to examine this clearly, it is clear that if you wear the mask correctly, it can really reduce your risk of infection. But a lot of people were failing to do that. But other things, you said you've really rethought, and that particularly you feel that our approach with children was wrong, that closing schools was wrong, and that indeed that the balance of risk for young children on vaccination was also wrong because their risk of getting COVID and being hurt was so low that actually you were at the same level of risk as a vaccine. Then we talked a bit about long COVID and the fact that not only is this real, but it's continuing. And one of the things that is a negative surprise is even people like me or you who've had COVID, we aren't guaranteed to be safe from long COVID from a future infection, which makes you think you really, you'd rather not get it, but it's going round and round. Future vaccination, for people who've already had vaccines can make sense, but you need to be at an at-risk group, and you'd really like to be having the vaccination that's actually well targeted to the current version of the vaccine, not the one from 5 years ago. And then I think we got onto this really interesting topic about what can you do to protect yourself from, infections in the future, whether that is a future pandemic or just flu, COVID, any of these sort of things. And this amazing data that the food you eat was one of the biggest things that could change, your risk of getting really sick with COVID, because we now understand that the food we eat has this profound impact on our gut microbes that then has this, profound impact on our immune system. And so by eating the food that is really going to support the right microbes, we can actually really improve our immune system. And I think you said it doesn't guarantee we won't get sick, but it basically means that we're much less likely to get severely sick.
Yeah, prolonged infections and hope, some evidence but preventing long COVID as well.
So the message, as is so often here and with Tim, is what you eat is centrally important. And, that somehow the more we study it, the more we understand how much it impacts, every aspect of our health.
Absolutely. Yeah.
Tim, thank you so much. And I will wrap up again, as I said, at the beginning, to thank so many people, those both listeners and non-listeners who participated in everything, during COVID 5 years ago. And I would just say, I think, I feel very proud, actually, of my part in this. I think when I look back on the whole Zoe story, it's a thing I'm going to feel proudest about by far. And I think everyone listening who took part in those studies or frankly did anything during COVID that was helping other people should feel really proud, because I think it was a very difficult time. And I hope you're wrong, Tim, and that there will not be another pandemic in your or my lifetime.
I very much hope so too. But yes, no, thank you, everyone. It was fantastic and very emotional, really, to revisit those times and realize what an amazing team, we and the millions of other people were. And it just shows